Welcome again, everyone. Let's get this webinar started. Thank you again for joining us for our webinar on transgender health and epilepsy. My name is Allison Kukla, and I'm the Senior Manager for Programs and Partnerships here at the Foundation, and I'll be your moderator this afternoon. I want to run through a few reminders before we get started. The mission of the Epilepsy Foundation is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. The foundation is committed to serving each person with epilepsy as they come to us. We do not elevate or discriminate any group because all humans are worthy of care. We see everyone as a unique person and provide assistance and support to anyone who comes to us. Doing otherwise would put our mission and our community at risk. Our utmost goal is the care, dignity, and welfare of everyone living with epilepsy. We are so grateful to the speakers who have joined us and to all who are here with us this afternoon. We have Dr. Genna Waldman and Dr. Emily Johnson. We will be discussing information on treating transgender patients with epilepsy, hormone therapy, and common co-occurring medical conditions within this population. We'll also have time later on to answer your questions. As I previously mentioned, when submitting your questions, please use the Q&A box. We might not be able to get to everyone's questions, so you can always follow up with us by calling our 24/7 helpline, and we'll be able to get to your questions. Also, we're not able to give specific medical advice, so please keep your questions general in nature. If you have specific medical questions, make sure to ask your healthcare team. Now, I'd like to introduce our panelists to you. They are both experts on our topic, and I'll start with Dr. Waldman. Dr. Genna Waldman is a neurologist specializing in epilepsy at the University of Pennsylvania. She completed her neurology residency at New York Presbyterian Columbia University. Following her residency, she completed her fellowship at New York Presbyterian Columbia University in clinical neurophysiology and epilepsy, with a focus in evaluation of surgical management in epilepsy patient. Dr. Waldman's expertise is in epilepsy with a focus on drug-resistant epilepsy, neuromodulation treatments, and reproductive and hormonal health in epilepsy patients. In addition to her clinical care of epilepsy patients, Dr. Waldman is active in resident and fellow education as a lead organizer for the educational lecture curriculum of epilepsy care at University of Pennsylvania. Welcome, Dr. Waldman. And we have Dr. Emily Johnson with us. She is a neurologist specializing in epilepsy and an associate professor in the Department of Neurology at Johns Hopkins University. She completed her neurology residency at Partners before completing epilepsy training at Johns Hopkins, where she is now faculty. She has clinical and research interest in sex and gender and epilepsy, as well as new onset unexplained seizures in older adults. Welcome to you both. I'm so happy to have you both here with me.
Thank you so much. It's a privilege.
Thank you. Yeah, great to be here today.
Yeah. So now let's get the conversation started and why we're all here to discuss transgender health and epilepsy. So I'll start with you, Dr. Johnson. How many people identify as transgender, and do we know how many people with epilepsy identify as transgender?
Well, that's a great question, and it's going to be a theme of things we talked to you about today, is that we don't know exact numbers and we really need more research in this area. But we know that according to most studies, between 0.3 to 0.9% of the population identifies as transgender or gender nonconforming. And that's about 25 million people worldwide. We also know that there's about 50 million people worldwide with epilepsy. So if the same percentages hold true for people with epilepsy, this would be about 150,000 to 450,000 transgender or gender nonconforming people who have epilepsy. However, we have some early data suggesting that it's possible people with epilepsy might be more likely to identify as sexual or gender minorities than people without epilepsy. So it could be higher. We need better studies in this area.
Well, thank you. That's definitely helpful to set the baseline for our conversation today, having those numbers. A follow-up question, you've published a recent paper that highlights the unique challenges faced by this group of people, which we're here to discuss today. Can you first define for us the term gender-affirming healthcare and its importance in this discussion we'll be having this afternoon?
Sure, thank you. So gender affirming care is medical care that aligns with a person's identified gender or their chosen part of the gender spectrum. This might include exogenous hormones for some folks. It might be surgery for some. It could include voice therapy, laser hair removal, or counseling, or any other type of medical therapy. Some people may choose to change their external gender presentation without medical intervention. So care that supports an individual's preferred or chosen gender or place on the spectrum is gender affirming care. As physicians, our focus is oftentimes solely on medications or medication interactions, but broader gender affirming care can be making sure that we provide an inclusive and safe environment for our patients who are trusting us with their health.
Thank you. I think that last line is very important, having that important, safe environment for patients with their care. Dr. Waldman, I'm going to come to you now. Many transgender patients will choose to undergo gender-affirming hormone therapy. How might that impact their anti-seizure medications and seizure control?
Great. Thank you. This is an important topic, and just this webinar as a whole, I'm so glad you guys are hosting it today. This question might be the longest answer, and so bear with me as I go through it. Like Dr. Johnson said, hormone medications is just a part of someone's whole gender affirming treatment. But there are some important questions that are raised that are really specific to seizures and epilepsy. First is, does the hormone therapy affect seizure medications? Second, do seizure medications affect hormone therapy? And third, does the hormone therapy have any effects on their epilepsy or seizures? And so you can tell that's a big topic, but I'm just gonna make a few points on each that are quite important. First, there's one specific interaction with hormone therapy on one specific anti-seizure medication, and that's lamotrigine or Lamictal. Specifically, we know estrogen can decrease lamotrigine levels, and it is safe for people to be on both, but adjustments might be needed to be made, specifically increasing the dose of the lamotrigine to ensure that someone remains at their seizure control or keeps their seizures away. So if someone's taking estrogen, and in transgender affirming treatments, the doses can be quite high, they need to discuss this with their neurologist prior to starting with doses changes or if they're stopping, because their lamotrigine dose might need to be changed or levels might need to be monitored. The second point was, do seizure medications affect someone's gender affirming hormone treatment? And there are some anti-seizure medications that are considered what we call enzyme inducers, or they impact your liver cells' ability to break down your medications, either increasing or decreasing the function. And we don't have any studies specifically looking into gender affirming hormone treatments, but we take this information from other studies that look at hormone replacement in conditions such as menopause, in birth control medications, or just the basic pharmacology we know. And what we know is if you're on these enzyme-inducing seizure medications, it might decrease the effectiveness of your hormones. So people on their gender-affirming care might have less of their desired effects of their gender-affirming treatments. There's a lot of seizure medications out there, and there are many that are not what we call enzyme-inducing. So in someone that's going through gender-affirming therapy with hormones, it might be considered first line to try seizure meds that aren't enzyme-inducing. However, some people's epilepsy might indicate they need to be on this medication. So again, you should really include your neurologist in your discussion of your gender-affirming care so we can talk about the interactions and pick medications that are right for you. Lastly, and again, sorry that this is a long answer, but do hormones affect your epilepsy? And this is a really large topic, and we don't have any good clinical evidence to guide us specifically in the transgender population and how their hormones affect epilepsy. We know that the levels of hormones, estrogen, progesterone, testosterone in our bodies at baseline does not seem to have a strong effect in someone's epilepsy control. And we know in conditions like pregnancy, where your hormones are changing drastically, people can remain with unchanged seizures and controlled epilepsy. But we do know in animal studies, estrogen can be seen as a proconvulsant or make seizures worse. So in a trans female, that might be something to discuss. But alternatively, there are some studies that show some protective properties. Similarly, progesterone is classically known to be an anticonvulsant or less seizures, but in studies that looked at cis women that took progesterone in menopause, it had varying effects on their epilepsy and seizures. Testosterone breaks down into estrogen, and its effects on epilepsy are less clear. In general, my guidance to patients that are undergoing gender-affirming treatments is they shouldn't delay going through gender-affirming treatments because of these potential interactions. But knowing that there might be effects is important. And again, including their neurologist to discuss the risks and benefits in their specific epilepsy, and making sure they're on the adequate seizure medications and doses, and have follow-up while they're starting and going through different doses of their gender-affirming treatments. That kind of wraps it up for that question, with one last point with Dr. Johnson made that hormones might only be one aspect of their overall gender-affirming treatments, and specifically, surgical gender-affirming treatments. Those are safe with people in epilepsy, and their medications shouldn't impact their ability to go through those procedures.
Thank you. That was wonderful information, all very helpful. And I was going to give you all the time you needed to answer that very important question. And, coming back to you, another question around medications. Are there any considerations to make with anti-seizure medications if someone is also taking antidepressants and or HIV medication?
With depression, we know there's a high prevalence in gender diverse individuals, and also separately in people with epilepsy. And I think importantly, we know there are some studies that support that gender affirming care can have positive effects on someone's mental health. So discussing your mood and mental health concerns with your physician is very important, and reviewing medication interactions. But in general, most antidepressants are safe with all epilepsy medications, and depression should be treated as medically indicated. For HIV, it's really imperative patients with HIV receive proper treatment to prevent life-threatening symptoms and reduce chances of transmission. Safe sex practices and regular testing is important. In people with epilepsy, there can be many interactions with their antivirals and seizure medications. And in this case, which is different than their hormone gender-affirming treatments, some seizure medications, in fact, might be contraindicated. So this is really important to review with your physician to check your interactions and make sure safe combinations are chosen. So it's my recommendation. It's extremely important. Always disclose your HIV and medications with your neurologist so that together you can choose safe seizure medications.
Thank you. Again, very helpful information for our attendees today. And Dr. Johnson, we know within the epilepsy population, there are comorbidities that are seen, depression and some other things. What are some frequent comorbidities that are seen specifically in the transgender epilepsy population?
Thank you. Great question. So as you mentioned, and as Dr. Waldman mentioned, depression especially is high in our population with epilepsy. So depression in the general population is about 10%, with a lifetime prevalence of about 20%. In people with epilepsy, it's higher. It's more like 26%. And in people who are transgender or gender nonconforming, it's about 56%, so more than half. We don't know yet what those rates are in people who identify as transgender who also have epilepsy, but we're concerned that it could be, again, more than half or even higher than that. This is another area where we need more studies, but depression is a major comorbidity for us to be aware of. We also know that HIV positivity rates are higher in people who are transgender compared to the general population, particularly in transgender women. And we need to be aware of this, especially because this is an area that's often stigmatized and people might be concerned about sharing this with their other doctors. So depression and HIV positivity are certainly ones we need to be mindful of. But also, I think of it as people who are medically underserved in general. A lot of transgender and individuals might be reluctant to access healthcare because of previous discrimination experiences that they've had. They might feel uncomfortable. They might not have good insurance. So this is an area this is a population that unfortunately is known to be really medically underserved, and we have to be aware of that as well, that it's just sometimes hard for patients to access care.
Yeah, thank you for all of those points. And as you mentioned, stigma, both of you have wonderful papers on this topic, and they highlight stigma as a comorbidity seen within the transgender epilepsy population. Dr. Waldman, what are some ways individuals and the community can combat this? I know that is a big question, combating stigma.
Yeah. I mean, I think education is key to our providers and our community. So a webinar like this, right, is really important to address stigma. I think in the scope of epilepsy, specifically in transgender care, I think it's important to remember that people with epilepsy, both cis and trans, might feel stigmatized by their epilepsy. And the Epilepsy Foundation is a really great resource to provide education about epilepsy to both people with epilepsy and their families and their communities. And regionally, they offer great support groups and services to all people with epilepsy. And Allison, I'm sure you'll be sending out links, and just going to the website, you guys can find those resources. And then stigma can be felt even more in the transgender community. I think when it comes to a medical perspective, updating your medical chart with your preferred pronouns is really helpful, so that you can be acknowledged with the pronouns that you identify with, and finding providers who are understanding and including your transgender care and your epilepsy treatment, I think is really important to combat this feeling of being stigmatized, and having an open and respectful medical environment to talk about both your transgender care and your goals, and get the proper epilepsy treatment.
I think you just bring up a wonderful point about, providers must recognize the challenges their patients are facing in order to provide that optimal support and resources. So making sure, you're finding those providers that can do that is really important. So, and I know we've talked a lot already in this short amount of time about the impact of treatment. And so this question is for both of you. Can start with Dr. Johnson. What are some important considerations when treating transgender patients with epilepsy? We might have some providers on the webinar today.
Absolutely. So Dr. Waldman talked to us a lot about those important medication interactions, which really need to be forefront of our minds if someone is receiving hormonal gender-affirming care. In addition to that, I think it's up to us as providers to make sure we ask about what other care a person is receiving, even if they don't immediately disclose their hormone use. You need to ask, are you seeing any other providers? Really get that full history. And I think it's really important for us to use gender neutral language as much as possible when we're, for example, asking about reproductive history, if we're asking about risk factors for pregnancy, to not make assumptions about the gender of the person's partners. And of course, offering our preferred pronouns and helping make that a safe space for people.
Dr. Waldman, anything you'd like to add to that?
Yeah, I think to, reiterate the theme, epilepsy treatment is individualized. I didn't talk about specific medications and treatments, but there's different types of epilepsies and different types of seizure medications. And so to get your optimal care, you need to include your goals of gender-affirming treatment and with your neurologist, so that we can include that in your treatment plan. I think something we haven't discussed in as much detail, but just to also make a point on, if you have seizures and are on 2 or more medications, you should see a comprehensive epilepsy center to be considered for epilepsy surgery. And gender-affirming treatments have no contraindication or interactions with our current epilepsy surgery treatments we can offer patients. And lastly, Dr. Johnson kind of commented on this, that providers shouldn't make assumptions about someone's sexuality or ability to get pregnant. And if you can get pregnant, you should also discuss with your neurologist effective contraception, pregnancy planning, and pregnancy prevention, because that can go into your epilepsy care as well.
Thank you. I just want to remind those watching, if you have questions, please use that Q&A box. We'll be getting to Q&A here shortly, so we want to make sure to answer your questions. So, Dr. Johnson, what can transgender patients with epilepsy do to make sure they're receiving the gender-affirming healthcare that we've been talking about? I know we talked about finding the right providers and all of those things. What else can patients do?
Yeah, absolutely. It's come up time and time again, but make sure your epilepsy providers really know what else you're taking, if that's any over-the-counter supplements or if that's hormones. Again, because of those medical medication interactions we want to think about. And if you're starting a new anti-seizure medication, if someone's prescribing you a new medication, don't hesitate to ask, will this interact with my estrogen or my testosterone or other medications you might be taking? Also, I really want to make sure people feel empowered. If you're not comfortable with your current provider, you should feel empowered to seek a second opinion or another opinion from a different provider. In general, it's possible that clinicians at larger epilepsy centers might be more knowledgeable about these important medication interactions. And especially if you're at a practice that's affiliated with a large setting that has a Center for Transgender Health, they're a great resource also to recommend people who might be a good fit. I will say that in clinicians who went to medical school more than a few years ago, there may have been very limited emphasis on healthcare for the transgender population, but your clinician, your specialist should be open to learning and to paying attention to this and to making this a part of your care, even if they did not learn it in medical school.
Thank you. And it looks like you just answered someone's question before they could put it in the Q&A box for us. And then I know this has come up right at the start of the webinar, and it's been a theme that we've had. So I'll open it to both of you and start with Dr. Johnson. What are some areas for future research in this area? What do we need to be doing?
Thank you. So, this is an area that's wide open, and only recently the national conversation has kind of turned to recognizing the important health needs of people who are transgender and gender nonconforming. One thing that I am looking at with some colleagues is looking to see, can we get epidemiologic data to really give us an estimate of the size of the transgender population, and to say, hey, are people who have epilepsy and who identify as transgender, is seizure frequency worse? Is depression worse? Are there these comorbidities we should really be aware of and reaching out to? And I don't want to, I'm sure Dr. Waldman and I have similar thoughts, but we need prospective studies where we say, hey, do the hormones affect people's seizure control? And if so, what should we be doing about that preventatively? I think those are two really major areas we need to focus on.
Very, very important work. And Dr. Waldman, anything to add? I'm sure you probably have some.
Yeah, I mean, very little to what Dr. Johnson just said. We know a lot about epilepsy. I think that there's more and more being reported in the medical literature about transgender care that's teaching us all and providing really good resources. But some of the specific things with epilepsy and hormones we really take from other populations. And so moving forward, I think there's a vested interest in the epilepsy community to look into this. And so when studies start to be able to be developed, and if you get asked to participate in one, I think that's going to be really valuable information, both for people's care currently and certainly in the future.
Thank you both. And so now we can open it up for Q&A, and I've had a few questions come in. So I will start, and I will just pick one of you, but you're both welcome to answer it. So I'll start with Dr. Johnson. What if I'm being denied care or mistreated by a healthcare provider because I am transgender?
Oh my goodness, I'm so sorry that someone is in that position. It is unfortunately not an uncommon experience among transgender people. So I think this is absolutely a time when getting another provider, getting a second opinion, reaching out to a large, if there's a university center or an academic center near you, or somewhere that has a center for transgender health or a transgender center, that would be a resource to start, because everyone has the right to healthcare, and I'm sorry, but it's possible, but there are people out there, as you know, that have very uninformed and uneducated and biased views, and you should not tolerate that kind of care. There are actually, maybe we can look for it and put it in the chat. At the University of San Francisco, UCSF, they have a wonderful kind of resource page for transgender health in general. But absolutely look for another provider. Go to a big center. That's never acceptable. And I'm so sorry that you're experiencing that.
And I'll just jump in here real quick. Speaking of resources, my colleague just put in the chat the Epilepsy Foundation's Jean Carpenter Legal Defense Fund is also a resource that's available. And the website epilepsylegal.org, or the phone number 800-332-1000 is available. If you have epilepsy and are being denied care or mistreated by a healthcare provider because of being transgender, you can reach out to us and we have that. But as Dr. Johnson mentioned, there's other things to do and other resources that we can find that we can share as well. Dr. Waldman, did you have anything to add or other resources to share?
Yeah, not specifically, other than there's a lot of epilepsy doctors out there, and I'm hopeful that many of them recognize the importance of transgender care. And so seeking someone else to provide your epilepsy care, hopefully in your area. I think it's difficult if someone's not close by. But even a consultation with telemedicine from a farther away institution might just help you put you on the right track.
I think that's a great thing to remember. Telehealth is still available in a lot of areas. So yeah, important to flag that for folks too. Another question we just received, I know we talked a lot about gender affirming care and finding, a good doctor. Any recommendations for checking whether a doctor is transgender friendly? Dr. Waldman, maybe start with you.
Yeah, I'll look for the resource, maybe to send Allison. I was actually just recently listening to a podcast by JAMA, which is a medical journal that has some guidelines on gender affirming care, and they put together a PDF of some centers. And so I think across the nation, people are trying to kind of coordinate that and recognize centers that are and that do. I'm not sure if Dr. Johnson knows of another place directly, but as she said, larger academic centers certainly are putting an emphasis on this. I know both of our institutions are, and I think several others within the epilepsy community. And so I think asking when you call to make an appointment from the front desk staff could be a way to ask as well.
And I think to jump off those excellent points you made, I think in general, what I've noticed is that the physicians in the area who tend to be the most willing to learn and to talk about this tend to also be physicians who are also interested in women's reproductive health care in people with epilepsy. I'm sure it's not 100% overlap, but if the center that you're going to doesn't have, probably won't have someone who's specifically listed as being a transgender healthcare resource. If there's someone who's interested and who focuses on managing women's health and pregnancy and childbirth, there's someone who's going to be at least thinking about hormones, and someone who's thinking about these interactions, and that might be a place to start.
And
Am
Tom just added to the
Okay.
chat the website that I was referencing. So thank you, Tom.
Yeah, he's good. He's fast. You can find those resources.
Yeah.
Another question that we got from a participant, there's been good discussion regarding estrogen and progesterone. Is there data regarding testosterone?
Yeah, I think we're more limited in testosterone. As Dr. Johnson mentioned, the field of kind of pregnancy is something we have more literature on. Obviously, in women who are in people who have the ability to get pregnant, that tends to be more guided around estrogen and progesterone. So we just know a lot more. We have some small studies that look at testosterone in very kind of specific populations. And again, it's testosterone being used for other clinical conditions. But it's unclear what its effects are. There doesn't seem to be a clear risk that it will make your epilepsy worse, which is why you should use it if you want to, as part of your gender affirming care treatment. But we need more research.
Thank you. And I know it's kind of been the theme around more research, so we can put that in that category. And we're getting a lot of questions here. We have another one. We know hormones can affect our symptoms for epilepsy. Are there currently any known risks or advantages related to taking hormone replacement therapy while managing seizures?
That's a great question. There's the one I always think about. There was a study now from about 15 years ago, but a study that looked at cisgender women who were with epilepsy who were going through menopause, and they wanted to be on hormone replacement therapy. So they randomized people to either a placebo or to a low dose hormone replacement therapy or to a high dose hormone replacement therapy. And they actually did see an increase in seizures among those who were taking the hormone replacement therapy. And it was more profound for people at the higher dose. So it's a single study, but it was enough to caution a lot of us from saying, hey, seizures are worse during menopause, let's just add the HRT. So I, in general, am actually, unfortunately, cautious about that, because the exogenous estrogen that is in the HRT seems to be different than our endogenous estrogen in terms of seizure effects. Dr. Waldman, what's your feeling on that?
Yeah, I mean, I think that a study gives us caution, but I think someone transitioning can be equally important to their life. And so that's why you just really need to talk to your neurologist about it. You know, what are your seizure types? What is your epilepsy type might go into that, and how are we treating your epilepsy? And I think that it still might be worth the risk of increased seizures in someone that really wants to be on this high dose estrogen in order for them to successfully transition. But then you just need to work closely with your epilepsy doctor so we can try to create a balance so you have the best quality of life from both of your, epilepsy, and then from, your need to, meet your identified gender.
And I'm so sorry, with the HRT specifically, in the context of the HRT, the hormone replacement, that had me thinking about menopause symptoms rather than gender affirming care. Absolutely, gender affirming care is a different scenario where, yes, even I 100% agree. Even if we need to be aware, that's one of the most important treatments for quality of life. So I really apologize. I didn't mean to imply that they were similar situations.
Yeah, and I think the alternative is, when someone who's able to get pregnant gets pregnant, their estrogen levels rise. And we see that people who are pregnant can go through their pregnancy without an increase in seizures. So then, that's kind of opposite of someone who, took estrogen in the setting of menopause that had worsened seizures. So,
Yes.
that's why, as we identify people who are open about being transgender, and as we're able to get research studies to follow them in a research viewpoint, it will help us learn specifically, how do these hormone treatments that you're taking in your epilepsy get affected. And again, to reiterate the point I made, your neurologist should be a part of this care.
I think it's always important to re-emphasize that point. And the next question we got, I'll bring to you, Dr. Waldman, because we talked about this, but I think it's important to re-emphasize. So I hope you don't mind me asking you this question that came in again. With hormone changes and other things that can take place with hormone therapies, is it likely my seizures may change or become worse? And I know we talked about this, but like I said, always important to, re-emphasize these things.
Yeah, I mean, I think the possibility is always yes, right? Your epilepsy and seizures may change as you're introducing or changing hormones, whether it's gender affirming. This question, I wasn't sure if it was those type of hormones or more generally any hormone treatment. And so sometimes a neurologist, if you have levels that you can check, might check your levels, right? I mentioned specifically the interactions of estrogen and lamotrigine. And so we might increase the lamotrigine dose as you increase estrogen, as you're going through to become a trans female, for example, as one specific example. So we can't always predict what the change will be. And for many people, they might have no changes, and their epilepsy control and seizure freedom might be maintained. But it is possible changes can occur.
Just to jump off that, changes can occur in either direction. There's a number of people who, there's cisgender women who experience catamenial epilepsy or fluctuations around their menses. And if they're going through hormonal treatment, so that's no longer a fluctuation, that's no longer a concern, their seizure control might get better with gender-affirming care. So it's tough to predict at times, but it could be for the better.
I think that's an important point to highlight too. I think people, as a person with epilepsy myself, are always thinking when things change, seizures are going to get worse, but sometimes it could, as you said, affect to get better, but we don't always necessarily think that way. We think seizures will always become, more frequent. So yeah, thank you for highlighting that point as well. So I think we've answered all the questions that have come in. I don't see any more in the chat. Let me just double check real quick. So I think we've gotten everything. So, and just want to highlight the resources that have been put in the chat to make sure everyone has seen those. Oh, one more question, if you have time, it just popped in here. What should people that can become pregnant and on birth control be aware of with AEDs, given some can reduce effectiveness of oral birth control pills? Now, open that to whoever would like to answer.
Yeah, I think similarly, as I mentioned with the enzyme-inducing seizure meds can decrease the effectiveness of birth control. We know for oral birth control, the implants and the rings. And so if you're on those for the reasons of contraception and not for other reasons, they might not effectively prevent pregnancy. So whether that's also using condoms, or for many of our patients, we recommend an IUD because that is known to not have these interactions with any of the seizure meds, and so gives the most effective contraception to prevent pregnancy.
And you covered the last question we got in your response. So we officially have no more questions that have come in. I know we had a lot, so I appreciate you answering all of those. And, I just want to thank everyone for joining this discussion today. And for your support of the Epilepsy Foundation and our webinar on transgender health and epilepsy. Most importantly, I would like to thank both Dr. Waldman and Dr. Johnson for joining us and sharing their expertise and passion with us this afternoon. So thank you both very much for being here.
Thank you so much. It's really a privilege, and thank you for listening.
Yeah, thank you for hosting and everyone for joining. A really important topic we got to discuss today.
This webinar has been recorded and it will be posted soon on the Foundation's YouTube channel, where you can find videos on all the other topics we do webinars on as well. And I just have a few resources I want to share with you before we go. I'm going to pull those up. We have, if you haven't yet been certified, we have our seizure recognition and first aid certification training, which provides information to increase knowledge, skills, and confidence in recognizing seizures and safety and administering seizure first aid. Participants who successfully complete the course will receive a 2-year certification. So you can do that anytime. And then we also have, as I mentioned a few times, our 24/7 helpline. You can reach out to us on it 24 hours a day, 7 days a week. The numbers are on the slide and it's available in English and Spanish. As I said, if you come up with other questions we didn't get to after the webinar ends, feel free to reach out to us and we'll get you those answers. And thank you again for joining us. And we're so happy you could be here. Thank you, everyone, and have a great afternoon.